Are you considering having weight loss surgery? Perhaps you're going through complex health issues linked to being obese, and all other alternatives closer to losing weight have failed. Obesity is a complicated health disposition brought about by many factors, including genetics, sentimental health, eating behaviors, and the living environment, with the tendency of causing a heart attack, diabetes, and so forth. Maybe it may also be time you regarded having bariatric surgery. However, before taking the bold step closer to having this surgery, watch this video to the end. Kindly subscribe to our channel and like this video for more exclusive content like this. Working out and eating right, though steadily beneficial, assist in a momentary weight loss. However, if you want to achieve a long-lasting result, you must proceed with reducing your calorie intake and hitting the gym. This may be worrying, aggravating, and time-consuming. Nonetheless, the bariatric surgical procedure has shown to be of considerable significance, particularly at dropping weight and nutrient, unraveling weight-associated diseases, and decreasing cardiovascular attacks. What is bariatric surgical therapy after all? Bariatric surgical operation is a type of surgery performed to assist people finding it impossible to forfeit excess weight, specifically those on workouts and weight loss programs. Evidence proposes that bariatric surgical strategies may oftentimes decrease the mortality rate of people with drastic obesity, primarily when bonded with healthy eating habits and a transformation in lifestyle after the surgery. The surgical procedure causes an alteration in your digestive system, thus enabling you to lessen excess weight and manage medical conditions accustomed to obesity. The principal goal of bariatric surgery is to drop off food consumption and minimize the assimilation of food in the stomach and intestines. There are 4 aspects of bariatric surgery often provided. If you had no idea, these 4 are adjustable gastric banding, Roux-en-Y gastric bypass, biliopancreatic diversion with a duodenal switch, and vertical sleeve gastrectomy. In the Western world, the commonly practiced weight loss surgical treatment is sleeve gastrectomy. In this technique, the general practitioner removes a giant portion of the gut to formulate a tube-like sleeve. Also, being sure of your condition, your medical doctor or fitness provider may propose surgical operations if your body mass index is 40, or at least 35. You have different health issues connected to being overweight. You have strived for months to forfeit weight with a weight loss plan and workout, but have failed. You no longer put up with alcohol, and you no longer carry an untreated illness or other basic health problems. Scrutinizing the manner or harshness of an obesity-related syndrome. Some adults or children with lower body mass indexes may feasibly undergo weight loss surgery. However, the normally ratified persons for a weight loss surgical treatment are between the ages of 18 to 65. Medics don't usually conduct this surgical procedure for weight problems in youngsters under 18 years of age. Weight loss surgery, alias bariatric surgery, unlike cosmetic procedure, will not get rid of adipose tissue, and after a lot of weight loss, you will still have surplus skin. Some patients are likely to endure other surgical methods to take away the extra skin. Nonetheless, people who are very fat are most liable than others to have health problems after going through with the surgery. Health issues after any weight loss surgical therapy may include infections at regions where the cuts were rendered, a blood clot can form and obstruct blood flow in the lungs, anemia, osteoporosis, kidney stones. You are inclined to regain weight years after surgical treatment, and there is a minimal risk of death like in any surgery. Every sort of weight loss surgery, on the other hand, has its risks. Here are a few examples. Gastric bypass and gastric sleeve surgeries might trickle from the belly into the stomach region, causing peritonitis. With gastric bypass, the link between the stomach and the small intestine may become slender. After adjustable gastric banding, there is a chance that you may require another surgical procedure to rectify problems that may occur. If you're thinking about weight loss surgery, you may as well think about the consequences involved. But if you're determined to go through with the surgery, you would have to meet up with different weight loss experts and specialists to steer you through the process and assist you to figure out if weight loss surgical treatment is the favorable choice for you. If not, a nicer option is recommended. What's more, bariatric surgery is one phase of the entire weight loss technique. Your treatment strategy will involve nutritional programs, workouts, and psychological solution. You'll have to be willing, and you must be in a position to follow all the long-term procedures to attain the weight your soul craves. What you do not know is, your success in catching up with the perfect weight wholly relies on your way of life, behavioral therapy, and eating habit. Weight loss after surgery depends principally on your ability to eat and work out behaviors. Also, desirable mental health is quintessential to coming next to your treatment plan. We recommend that you seek medical guidance before going in for a weight loss surgery. On the other side of the coin, if you consider having the surgery, carry in mind the likelihood of risks involved. I hope you enjoyed today's video. Don't forget to subscribe to our channel, hit the notification bell, and like this video. Thanks for watching.